To some other news now out of Canberra, and this is a summit that's been held in Canberra today on women's health. It relates to the fact that 2/3 of Australian women say they've experienced gender bias or discrimination when accessing healthcare. That's according to the federal government's landmark End Gender Bias survey conducted to improve access to healthcare and outcomes for women. The Assistant Minister for Health and Aged Care is Kearney. She handed down the report today and I caught up with her a short time ago. Kearney, thanks for your time. As a health professional yourself over many years, what did you make of this survey? Were you shocked by the level of gender bias in the health system?
Well, I wasn't surprised by the response. As a health professional and as a woman, I have understood the discrimination and bias felt by women in the system. But I've got to say I was a little bit shocked that 2 out of 3 women say they experience some form of bias or discrimination in the health system. And 70% of those said it happened at their local GP or their primary healthcare facility. So these outcomes are shocking. It certainly shows that we really need to do something about it.
How does it show up? How does that bias show up, say, in a GP visit or a medical consultation?
Oh, so many ways. The most common thing is that women say that they are dismissed, they're not believed. They're told, for example, if they have pelvic pain, to just put up with it. It's just your lot. You know, if women get periods, that's life for women, but we know that isn't true. For 1 in 7 women in this country, around 1 in 7 women who have endometriosis, for example, that pain around menstrual cycle is excruciating. Now, these poor women, it takes on average 9 years to get diagnosed. They're accused every time they present for pain relief as drug shopping, as being hysterical, faking it, or being told to just, suck it up. So that is one prime example. Around sexual and reproductive health care, we know that women feel ashamed, embarrassed, dismissed, sometimes even turned away when they've asked for help. That's just some of the things that I can explain to you. There's a classic, women that are overweight, for example, tell me that sometimes they go to doctor with serious symptoms and all the doctor says is just lose weight, you're fat. So all of these things that we are hearing from women, it's just not good enough. If you are a woman of colour, if you are a woman with disability, if you are someone from the LGBTIQA+ community or a migrant, we know that these issues are compounded even more.
Something that I've noticed just with taking my daughters to the GP in recent years, there are more and more young women as doctors, though. It seems, I'm not sure the exact breakdown out of the universities, but is that something that will help the cause, having more women general practitioners and medical professionals more broadly?
I really do believe that is the case, yes, but we can't just rely on them. Often we're finding that women GPs, the male GPs say, oh, you've got women's problems, pop down and see the woman GP. So she often gets a lot of the more complex and difficult patients. This has created a situation where there's a gender pay gap for female GPs. But inherently the system is not right. So all of the clinical guidelines, or a lot of the clinical guidelines and symptomology, is designed by men, about men and for men. Classic example, heart attack. So heart attack symptoms, you present to ED, here's the signs and symptoms that the system tells you. Chest pain, pain in your left arm, pain in your jaw. Women don't get those symptoms with a heart attack. Consequently, you're twice as likely to die of a heart attack because the clinical guidelines just aren't clear enough for what women present. So we've got to change the system, we've got to change those things too.
Indeed, and your summit today, the Women's Health Summit, what do you want to come out of it?
Well, I've established the National Women's Health Advisory Council, and we are looking to the summit today to reinforce what we know. The survey has helped, but we are going to listen to a lot of the experts, people with lived experience, advocacy groups, to help us hone our priorities. We're going to feed back some of the work that we've been doing to get an indication if we're on the right track. So it's really about honing the work that we're going to take on after this.